Hello and welcome to YouTube channel HealthQ, the place where our mission is not only to motivate you but help you to move on to the brighter side of the health. As always, I am here with one very interesting conversation with Miss Priya Nair, who is a yoga therapist and have got amazing experience in teaching yoga, in training people suffering from different health related conditions. But most importantly, she's working with people with fibromyalgia, a condition which is sometimes just dismissed by doctors, sometimes stay undiagnosed for a long period of time, and the people who suffer from it just are left helpless to what to be done about that. And these people get help from her with the help of yoga therapy. So we are going to discuss about yoga. We are going to discuss about what is yoga therapy, how yoga therapy is different from conventional yoga, and how the benefits of yoga therapy can be added up as an additional tool for any individual who is seeking not only recovery but a good quality of life. So, welcome Priya, welcome to the show.
Thank you, Meghna, for having me here, and always good to collaborate with you. And we have had a few talks on fibromyalgia before, and I think a little more detailed conversation will be very useful for all.
Right. So, Priya, tell me something about your journey, how you started with this yoga journey altogether, because you come from a technology background,
Right.
you are a software engineer, from there you transitioned to yoga. What made this happen?
So Meghna, as you know, I'm an electronics engineer, worked in the corporate world for a few years, and I've always been a fitness enthusiast. So I was a runner, I used to do heavy weights, and yoga was always there because I knew the benefits of yoga. I needed to do yoga to be able to do my running and my gym. But as you know, yoga, most people find it boring because you don't sweat so much, and it's not most people's cup of tea, at least those days. This is like 10-15 years ago. Over the years, I left my job, I had kids, and I was taking up baking for a while. I was a professional baker for a few years. And at that time, some family crisis happened, some health issues with parents and things like that. And I started to see that yoga, when I used to go for the yoga class, that was when I felt very calm because there was stress, there was cancer in the family and things like that. And yoga really made me feel good. And I started doing more of yoga and less of running and less of gym, and I started really seeing the benefits it had not only on the body obviously but also on my mind. And that was when I decided to delve deeper because yoga philosophy was not offered. Right now we have social media and there are a lot of videos, a lot of information on Instagram, on Facebook, on YouTube, but 7-8 years ago there was not enough information, and the only way to learn about yoga philosophy was to go to a teacher's training. And I never in a million years thought that I'll be a yoga teacher. But as I delved deeper and deeper, there was so much to learn and it was so fascinating that I started fully went into the yoga journey, became a teacher, and subsequently did many courses on prenatal, on therapy. And now I have a good mix of yoga therapy clients, pregnant women, and regular yoga students as well.
Right. So, tell me something, what makes yoga therapy different from a conventional yoga?
So this is a question most often asked because in people's head, yoga and yoga therapy are the same. People come and tell me I have neck pain, I did yoga and it became okay. And there are also some people who come and tell I did yoga and my back pain got worse. Okay, that's where this therapy comes in. If you have a mild discomfort, like just stiffness, regular yoga will help with stretching and strengthening. But if you have a condition like a cervical spondylitis, or you have a disc herniation or a disc bulge, then if you go to a regular yoga class, you have the chance of aggravating the condition. Right. So you then go to a yoga therapist who is going to work specifically with your condition. And it could be not only musculoskeletal, it can be thyroid, it can be BP, it can be autoimmune, it can be arthritis. And you work with the therapist just like you work with the physiotherapist for a few weeks/months. And all the practices are catered towards that condition. Whereas in a regular yoga class, it's a general class to maintain your good health, maybe improve your health a little bit, but it's not condition specific. So now you're first working on the condition, you're learning to manage the condition, and then you move on to a regular yoga class. So therefore, you have to go to a yoga therapist who has deep anatomical knowledge because able to read your reports, right, and then able to guide you so that you are reaching a point where your body is able to take a regular yoga class. So the difference is this, that one is general and one is a highly customized format.
So, in my experience, what I've seen, no, any patient, any sufferer who is suffering from chronic pain or acute pain, I personally believe pain is something which is just a symptom. It's not a core problem, right? And people consider that if pain is gone, they are okay, but it's not the case. They are more likely to get it. So, when people come to us, what I try to explain them or say that pain is a journey and it will go away, but you need to maintain it, right? So initially you will need physio, definitely, but after that you have to come up with certain practices that will make sure that you stay away from that pain. You don't let that pain come. So my question here is, if a person who has history of chronic pain or history of fibromyalgia in that general, right, should continue with a regular yoga practices. These yoga practices should come from a conventional yoga therapy conventional yoga standpoint or yoga therapy standpoint.
See, yoga therapy also uses all the tools of yoga. Okay, you're using your asanas, the pranayamas, the meditations. Everything is the same because yoga, it's a subset of yoga.
Right.
So if the teacher has good experience with this condition, because experience also counts, then you can actually go to a regular yoga teacher who's not certified yoga therapist, but simply because of experience, doing a lot of research, you can go to a yoga teacher. But you have to be very careful in that selection. Because like I said, a yoga therapist goes through a lot of anatomical studies and is able to cater to certain conditions. So, but the practices are modified, but it's all the same practices of yoga. So to answer your question, you can go to a regular yoga teacher, but someone with good amount of experience, especially with a condition like fibromyalgia and chronic pain, because like you said, it's an undiagnosed condition and there are no physical or structural issues in your body.
Right.
So that yoga teacher has to know the history and geography of fibromyalgia specifically.
So that was something which is there. Now let's move on to fibromyalgia and have more discussion about it. What, in your experience, are the misconceptions that people have regarding fibromyalgia? Because I have seen that people just dismiss it many times when they go to doctors. They say it's a postural problem, a lifestyle problem, and sometimes for years the fibromyalgia is just undiagnosed, right? So if someone is coming to you with a very chronic pain and wants to bring that lifestyle modification or wants to take that path of yoga to get out of that pain, how is this process like?
Like you said, it's an undiagnosed condition, right? But if you're in constant pain, first of all, don't be afraid to reach out. If one doctor is not able to help you, and you surely know that because it's real pain,
Right.
it's not, you are not making it up in the head. So there is pain in the body, and you have to sometimes go through multiple, doctors to reach the diagnosis. Yoga will definitely help, yoga therapy specifically. Main lifestyle changes that you have to do. One is you have to pace yourself. Okay, you have to learn to slow down, because one of the main things in any of these chronic conditions is that we are fighting the condition, resisting, and we are continuing with the same. We want to do what we were able to do yesterday,
Right.
but now your body is not able to do it anymore, right? So you have to pace yourself. You have to learn to connect the energy you have to the activity you're doing. The days you have great energy, you can continue your regular activities, but some days are just severe fatigue.
Yeah.
And you've not slept at all, and those days if you push your limits, already your it's a nervous system
Yeah.
disorder.
Right.
Already your nervous system is hypersensitive, and now you're pushing your limits, and that is further going to sensitize your nerves even more. So you have to learn to pace yourself. Another important thing is to have a very good sleep routine. Most fibromyalgia patients have difficulty falling asleep, or if they fall asleep, they wake up and they're not able to fall asleep again. It doesn't give them enough rest, so they don't feel refreshed in the morning, which leads to tiredness throughout the day. So they have to learn to switch off at a particular time, or preferably earlier in the night, so that they're able to catch up on their sleep. Because all of us, are watching Netflix,
Yeah.
or we are on our phone. We are not listening to the body. Body is tired, body wants to sleep, but we don't, because we have a lot of parties, we have a lot of other things. So you have to tune into the signals of your body, get your proper rest. Third important thing is to do exercise. Okay, any kind of movement, physio hai, yogasanas are there, walking, strengthening exercises. And although it seems counterintuitive that I'm in pain and now you're asking me to exercise, but start very slowly, start very gentle forms of stretching, slowly add strengthening, and do the exercise, because it's going to help you be resilient and improve your immunity, feel energetic. So these three things are really important to be able to manage this condition. And most important of all, like I always say, is to work also with your mind, not only with the body, right? Acceptance is one very big part of any of these chronic conditions. We don't accept why it happened to me, and then we get into that whole journey of depression, anxiety. Obviously, it's unfortunate that you're going through this, but once you've accepted the condition, then you're no longer fighting. Then you're in the nervous system again is not in the fight or flight mode. Once you've accepted it, then you move forward.
Right.
What can I do about it now, right? So that attitude shift is very important, and yoga therapy has a big part to play in that. Because you use breathing, you use meditations, you use affirmations, and slowly you're shifting your whole mindset. Because this is a lifelong journey. You may be pain-free today, but tomorrow might suddenly be a trigger and you'll have a flare-up. So you have to be able to adapt to this kind of physical pain all the time. So if you're mentally very equipped, then I think this journey is going to be manageable. So these are the very important points.
So I have two questions basically. I'll first ask you the first one, and that is, yoga has a lot of linkage to our ancient way of practices, right? And Ayurveda comes very obvious when it comes to ancient India. And Ayurveda very typically says Vata, Pitta, Kapha. These are three ways. So where fibromyalgia falls into? It's a Vata problem, Kapha problem, Pitta problem.
So see, mainly any chronic pain is usually a Vata problem. Okay, a Vata aggravation leads to fibromyalgia, but of course there are other imbalances. It's not like one. There are three Vata, Pitta, Kapha. Any one is imbalanced. It also causes imbalance in the other two. So although it is a Vata problem, it also imbalances your Pitta and Kapha. Okay, so mainly a fibromyalgia patient should follow a Vata pacifying lifestyle, which means your Vata is aggravated and your pain levels are high. So you need to lead a lifestyle in which your Vata starts to balance. So the diet should be Vata pacifying, your daily routine should be Vata pacifying. But you have to also keep in mind some symptoms that are high Pitta symptoms. In that case, you have to, in your food especially, reduce Pitta foods. So when you again go to a yoga therapist, when someone comes to me, we analyze the dosha at that time. And at that point when you come to me, I analyze the current dosha, it's an imbalanced state. Okay, and I'll see that, and it's not only the numbers, it's also what you're telling me, that I can't sleep, I have anxiety, all this is a Vata problem. Sleep issues, anxiety are all high Vata problems. So we start to work on practices that are going to reduce your Vata. I'll suggest some diet, I'll suggest like massages are great for Vata people. No raw foods for Vata people because it increases your Vata. So steamed foods, no salads after 2 or 3, raw vegetables. Don't do raw stuff, do only steamed stuff. Very basic things like this, Vata people should not do very intense exercises, but they should do exercise, gentle. These things are all Vata pacifying activities. Lot of calming practices, because Vata is again, your mind is always running from one thing to the other. So a lot of calming practices are required for Vata. So to answer your question, between Vata, Pitta, Kapha, fibromyalgia falls under the Vata imbalance, but it will also affect all the other doshas as well.
Right. And that takes me to the next question, and that is something more gender oriented. Females have got higher tendency to develop fibromyalgia over males, right? Maybe it's the hormonal imbalance or whatever is the reason. But what are the practice changes that applies when it comes to a female survivor of fibromyalgia to a male? Because the symptom patterns changes. So males are less open to share about their pain and discomforts, and that's where they are more likely to develop mental health related issues, suicidal thoughts and all. Whereas women who are more open to share their pain with people, they have more of emotional outbreaks. So even though mental health picture is different in both the scenarios, what can be different from a practicing point of view to deal with these two genders?
That's a good question. From yoga point of view, we don't have a gender discrimination as such. We follow the similar practices, and then in that case we have to go patient by patient. As you said, women, we go through a lot of hormonal changes. So actually a lot of meditation techniques and breathing techniques works on hormonal balance as well. With women, like you said, they fall into the they share but they also get into that victim mode, and they get into whining mode, and they become very negative. And men, as you said, they suppress, you know, so they are more tight in the body, and they have they are not unable to express. Women, we express too much sometimes, and may not be in the your family may not be accepting to the change, you know, that you have become very whiny and negative. So we have to work on that, in the sense, like I said, acceptance is one, hormonal balancing techniques is one. Women also have the tendency to ignore their health, you know. As you know, we've had patients who are not very regular. They want to improve. And women, I find, are more, if the men commit one time, usually they stay committed. Women have more responsibilities. They have exam hai, then they forget about their health. You know, something happens and they forget about what they have to do, and they put other things first. So I think with women, that is very important, that to put your health first, because if you are healthy, the rest of your family are healthy and happy. Another thing I find, especially women who are a little older, towards menopause, they start to lose strength. So again, they have to work a little more on the strengthening with physio and with yoga, and they have to focus on the strength part as well, apart from the mental part, because that is going to help them for recovery. Women give up a little more easily, I feel, than men, but they come to you faster, but the commitment levels are sometimes less because of all the other problems that you face at home.
And I believe there is dependency factor as well. So good part is now women are getting self-independent, and they are becoming financially independent as well.
That's a big part.
And they are open to take therapy, and they are open to take services. But sometimes women who are not working, or sometimes who are dependent on their spouses, they still have that thing. There is a dependency of travel to center, or there is a dependency of. So women have dependency on their husbands, that when they are able to drop them to the center, and that's, so I think there is a lot of accessibility challenge as well. Therapists are not available who can go to their home, because that's an expensive affair, or it's coming to centers are also an expensive affair.
Or timings
may not suit. Even yoga therapists, it's very difficult to find authentic yoga therapists or yoga instructors as well these days. Anybody can put their name and all. So what is your take? How we can solve that problem? What can be done for that?
So Meghna, one is what you are doing is amazing, because the accessibility has, you know, that's a big thing. People have access to experts. So they have to actually look out in their area. If they want only offline classes, then they have to look out what is there in their area. But another great option nowadays is this online medium, because especially after COVID, people are open to exploring online mediums, and yoga therapists and physiotherapists are accessible online now. So I think for women who have these issues of travel and of time, kids go to school, they have to pack up their husbands to work, and then in the afternoon they have time, do an online class. You know, it's very effective. Although I know some people like to come offline, but see, none of the practices, especially in case of fibromyalgia, are very intense, because they're already in pain. You know, and one-on-one on the video, you are still able to do a very good alignment check, and you're able to connect to the patient very well. So online mediums can be explored. And I know that HealthQ is coming up with videos, you know, on conditions. So then do videos, and there are very detailed part-by-part breakup of nutrition, of physiotherapy, of yoga therapy. Get some package like that where you're getting your holistic, you know, wellness taken care of. So I think you should keep your mind open about this offline versus online, because online is as effective, if not more, because you will be more regular with the online medium.
I would just like to talk about a very interesting finding that I had. So I was reading through this WHO article, and it was mind-boggling. Like 2.4 million people globally by 2030 will be requiring services like physiotherapy, rehabilitation services like that, right? So like 1 in 6 is going to suffer from some sort of pain or movement related challenge, right? And on contrast to that, if we look at the numbers of the providers, the physiotherapist or yoga therapist like you, 0.59 people are there to serve to 10,000 audience, right? So there's a huge gap between demand and supply. So when we were doing a further deep research, what we realized is that if we want to reduce or solve this accessibility problem, then we have to categorize, or else we have to create segments or zones. So there is a huge zone of people which fall into this preventive zone, right? So these are the people who are suffering from condition that will not require a surgery surgery nor a medication.
Okay.
They will suffer from this chronic pain issue, and they can very easily, or just by practicing simple methods of yoga therapy or physiotherapy on their own with the self-care practice, can manage and prevent sustainably their
Without aggravating it further.
without aggravating the problem. And that's where I see an opportunity, that if we are going very high on tele-rehabilitation, if we can use these tools like videos and all, we can address that big gap, so that a physio's or your therapist's time is spared to cater to someone who actually genuinely need one-on-one support. Right. So that's where there is a gap of awareness which needs to be built on. What's your take on that? Like, how much people are now getting open to try online services? And
see, I think it's a very good, the research is mind-boggling, as you said.
Right.
I think videos are a great medium, because when you're in the very initial stage, maybe you can do 1 or 2 sessions with with the therapist online and get your basics right. But after that, anyway, it's a lifelong condition. You have to be able to manage it. You can't always be dependent on external help. And if you're at that very early stage, then these videos, if they are simple enough and they are catering to the problem, I think it's a very, very interesting innovation. And if we are able to deliver it in such a way that it's very detailed, step by step, and it's value for time, right? So I think it's a very good initiative, and we all as therapists also owe it to everybody to be putting this information out there, because physical limitation is there. I cannot do more than X number of people in a day. And like you said, somebody who really needs, I can do one-on-one with them. But somebody, very basic movements like stretching, body movements, I can do it in a video and share it with somebody who needs it, right? So that's the only way to go. If we are 0.05 or whatever number you said, there's no other way to
0.5. Yes, I would also like to share a concept which I personally believe in therapy, like when we work with patients, right? There's something called as defaulters. That's always going to be there for a patient to follow, right? And then there is something called as progression, right? Be it pain, be it fibromyalgia, any condition. Defaulters are something that don't change, that you have to continuously do in order to maintain your health and wellness, right? For example, doing meditation on a daily basis is a defaulter for you. The way we do brush every single day, we have to do it, right? And we don't miss it because we have subconsciously develop that habit. But if people are subconsciously developing the habit of doing meditation on a daily basis or doing pranayama on a daily basis, right, that becomes so empowering for any individual that progression also becomes easy. Much easier, right? Otherwise, what happens? A person only takes care of the health when the problem arises, when things have gone worse. Right, and then when they come, it also takes that long period of time to achieve result and recover. What is your take on creating these defaulters? What are these defaulters from a yoga therapy standpoint, or from a yogic practice standpoint? Because yoga is nothing but a lifestyle, right? Yoga is not a practice of healing, but it's a lifestyle practice, right? So tell me about you. What are 2, 3, 4 defaulters that you stand by in order to maintain your health and well-being?
Okay. So see, I tell everyone, yoga therapy is not a treatment. Okay, what we are doing in yoga therapy is your body has this inherent capability of coming to balance. What we call homeostasis in medical terms, right? We have that capability. Everyone's body wants to come back to a state of equilibrium. And what yoga therapy is doing is only helping you. What you already have, we are just bringing you back to balance, right? So to bring the body back to balance, there are some things that you have to do every day. What I do for myself is, because I start classes early in the morning, and once the day goes by, it's very difficult. There's noise, there's phone, there's so many distractions. I wake up in the morning and I do minimum 20 to 30 minutes of my pranayama and at least 10 minutes or 15 minutes of meditation. And meditation can be just simply sitting with your eyes closed and not thinking of the day, watching your breath. Or it can just be focusing on your eyebrow center and just letting your thoughts come and go. Something very simple. Or if nothing, I'm very distracted, I just put on some Om chanting and I just close, or some morning Gayatri mantra or something, and just listen to it for 5-7 minutes. What you're doing in this time is you're preparing for the day. How you get up in the morning and have your chai. You hear people saying that I need that morning coffee to wake up. So this is your morning dose, to wake up in the morning, because rest of the day you're out there. You're putting yourself out there, and there's not even a second in the day where you're You are tuning into yourself, right? We are not tuned into our body. Our frequencies are always turned out to phone, to everything else other than yourself. So the morning time, tune in to your breath, tune into your thoughts, do some very basic stretches, tune into the body, and that's all you need. That defaulter has to be there every single day. And when I say every single day, need not be 365 days a day, days in a year. It can be say 300 days a year or 250 days a year. You're traveling, you've slept late, fine. But do something. Go out for a walk. Do your basic 1 or 2 pranayam. It will take 5 minutes. The time we will go on an Insta reel, and that much time you require to just, so these 3, some movement, breathing, and just sitting still without any other distraction, not starting to plan for the rest of the day, will have to be your defaulters. Okay, this is in terms of body and mind. Diet, very important. In fibromyalgia, as you know, that diet or any chronic disease, you have to watch what you're eating, because at the end of the day, whatever inputs you're going to put in your body is how your body is going to react. So be very conscious throughout your life. What you're putting in terms of thoughts, in terms of food, in terms of what content you're reading. So again, keep that as a default. That I'm not going to let anything negative enter me. It can be words, it can be something you're gossiping, anything at all. Don't get in negative energies at all. So if you start, that is a yogic lifestyle. If you start practicing these things, it will become a part of you. And I'm not saying you'll never get a disease. This is a body, it has to go one day. But at least we can be happy, and we are going to delay whatever onset of any symptom what happens at 30s. Nowadays you see 20s and 30s people are having long-term autoimmune disorder. You're going to delay it a little, like our nannies and daddies till 90. My grandmother has no chashma. You know, she is fresh and bright and only joint issues because body has now become old. But no glasses, no hearing aid, very sharp, still knows how to do YouTube at 90, right? So we want to be close to that. So.
And I believe, many of the people are getting more influenced by the Western lifestyle. But if we see our own origin, it's so rich culturally. It's designed to keep your body healthy, right? So if we can just take those basics and start implementing, it has a huge effect. So as you said, I would just like to share my practice that has got a huge impact in my life. So every morning I make sure the moment I wake up, I read one verse of the Bhagavad Gita, and I just do a chanting of mantra, which is just 108, right? And that sets everything apart. And initially it was difficult because, and even some days you get late and all, and you can't do it.
Any new thing is difficult to get into habit.
Correct. But what I've started realizing, the days when I do this, the day is more productive, more clear, and is less exhausting. Compared to the days where this has not happened. And it is kind of creating a principle in your life that this has become a defaulter for you, and automatically you go into that auto mode. The moment you wake up, your first hand is going to pick that book, and it's going to start your day in that way. And it makes, there's something called as decision paralysis, right? Like what I should do next day, and that reduces, and then you start developing that clarity. Similarly, before going to bed, make sure that you don't watch any reels, nothing, but just keep a calm music and and that kind of somewhere prepares your body to sleep, and the quality of sleep has improved a lot.
Correct.
So this is the change which I have kind of observed, and I've started telling to people, yes, this is what I am experiencing.
Correct.
And if I can benefit it, definitely anybody can definitely benefit it. So that takes me to the next question, and that is about the progression. What is progression like? What is progression in yoga therapy? What is the goal? What are the aims? Or what is the purpose behind giving progression in every yoga stages?
See, I would say initially when you come, you are in very high level of pain. So when you start yoga therapy, we start with very, very gentle practices. Okay, it might be very basic stretches, especially in the neck, and the trigger points mostly are lying in the neck, the shoulder, the chest, the upper back. A lot of trigger points, tender points are there. So you will work on releasing the tension. So the first step is to release all the tightness, because your body is stiff and you want to start releasing. So that will be the aim. With breathing techniques, you're relaxing, with the meditations, you're centering and calming your mind. A progression would be slowly you will start to add little strengthening. So I call it the SSR, stretching, strengthening and relaxation. So you're then going to progress to adding little strength practices. So after stretching, when your body is a little open, you're going to add a little bit of strength, because when you're in pain, you don't move, and when you don't move, you're even more stiff. And when you're not using the body parts, you know that wastage of the muscles happen, you start losing strength. So you start to build on strength. This is only the physical aspect. In yoga therapy, the goal is to increase your awareness to that level that before the pain or before the triggers have reached a point where it becomes very hard to come back, you're able to identify right at the beginning, because there are always signs and symptoms of anything, right? We are just not tuned into it. Once it happens, then you think back and you say, okay, something, I had sensed something is missing, but you didn't listen to it. So you're developing that sense of awareness that before we reach a particular point, you're arresting it early enough so that your condition doesn't worsen. So we are going to add those techniques by, again, all these meditation and breathing is just going to tune in. Your body is giving you signals. You're only connecting to your body using technique. So not only the physical progression, we are also working on mental practices to be able to tune in better to your body and environment. Another progression I would say using yoga philosophy and all that is to share with friends. Many people withdraw, their social activities become zero because one, they're in pain, and secondly, because people have not understood their condition, they have withdrawn into a shell, and sometimes they're highly depressed, suicidal, as we discussed. So using yoga philosophy and counseling, yoga therapy, a lot of it counseling is required. You're going to slowly, the progression is again change your mindset, be out there. Good days you be out there, bad days you can take a back step. So slowly your social life, your physical health, your mental health, spiritual health, you're going to feel good about life, not feel bad about waking up in the morning. You're going to start feeling happy for what you have, not for what you don't have. Those mental shifts are also part of the progression. So it's a holistic thing, physical, mental, emotional and spiritual. All these things slowly with each patient you have to move forward. And then they're on their own, because this is a lifelong condition. They have to be able to manage it on their own and not be dependent on anybody other than themselves.
That's there. And I would just like to drive your attention towards certain practices. So what I understand is there is pranayama, there are asanas, then there are mudras, right? So can you put some light on what are these mudras and what is the significance of those mudras?
So yoga is an 8-step. It's called Ashtanga, right? There are 8 paths to reach. Yoga is a spiritual path. So you're slowly building up and going from yama niyama, just how you live your life. Be truthful, be clean, don't steal. There are certain rules by which we all live. So first 2 steps are yama and niyama. Asana is the 3rd part of yoga, 3rd limb. 8 limbs are there, where you are preparing your body. So keep your body healthy and strong. If you have any condition, use the practices. Keep your body strong. Breath work is the next. You use your breath, because when we are stressed and anxious, breath goes high. You start to learn to calm your breath. So mind and breath go hand in hand. When you're in tension, breath increases. When you're relaxed, your breath is really calm and slow. So the 4th limb in yoga is you use your breath. Try to always be calm. Even if you're getting angry, suddenly heart rate and breath you start rising. So you start, why we say breathe? Because we breathe slowly, anger will start to reduce. So the breath and mind are connected. In any disease, you can apply this concept. Okay. Now the next 4 limbs of yoga are all in the next pranic level or energy levels. So mudras come under that part. So mudras are gestures, not only hand gestures. There are different mudras. So I am talking about hasta mudras, which we use our hands. Okay. Certain gestures we use, and these are 5 elements. The 5 Panchmahabhutas. This is fire, air, space, earth and jal, water. Okay, when you do certain hasta mudras, you are balancing the elements in the body. For example, when I said fibromyalgia is a vata problem. Okay, now vata is made up of air and space in terms of elements. So when you have high vata, it means your air and space elements in the body are high, and it's moving. Air is moving, right? So pain is moving in fibromyalgia. So if you connect it like that. So when you do mudra, you want to balance the air element. So when I do this mudra, this is called Vayu mudra, this is air element. I suppress air element in the body. And I hold the Vayu mudra for some time. So energetically, Vata has risen, you're having pain. You reduce the Vata in your body with this mudra. 10 to 15 minutes you hold, be aware of your breathing, and slowly there are circuits created. These are all very subtle. If you ask me scientifically how do you prove it, there is no line or anything that is showing me this. But because in Ayurveda and yoga we believe in Panch Mahabhuta theory, when you're doing this, I'm suppressing air, and because of suppression of air, your pain will start to reduce. So like that, each mudra creates certain subtle energy circuits in the body, which will cause shifts. So your pain will reduce. Or for example, if you have swelling, edema, it's because of high water content in the body. So this is Jal, water. You suppress water element and hold for some time. Slowly the water element will start to balance in the body. So like that, the mudras have significance. There are some eye mudras, there are some facial things. So a lot of mudras are there in yoga, which based on your symptom and condition, we will apply it and we'll tell you how much time to hold. And that's why it's important to go to someone who has experience, because mudras are, although they seem that nothing much is happening, they can have a powerful effect. You can generate heat in the body, you can reduce. For diabetes there are mudras, for heart problem mudras, for migraine there are mudras. So they are quite powerful techniques, which we don't use in normal yoga classes, because people usually come for fitness. We use Dhyan mudra, in the classes. Very basic. So like that, there are a lot of other mudras with therapeutic benefits, which we use in yoga therapy.
Okay, yeah, that makes sense. And is there any particular guidelines, or is it something that anybody can practice just immediately, or it has to be followed with certain ways and methods?
The mudras,
Yeah.
So see, some mudras you can do anywhere, like Vayu mudra that I said, you can do anywhere. You will be sitting in a car, you're sitting on a call. Ideally, you have to be aware of your breath, but you can still hold the mudras. We are still creating that circuits. Okay, but like I said, somebody should guide you as to what mudra. Don't go to YouTube and start doing any mudra. Chin, dhyan and all are fine. Meditative mudras, you can go and do on your own. But any other mudra that you do, make sure that there is some guidance from some teacher, because you are playing with the elements in the body. You might be thinking that, I am doing something, but something else might be happening. So they can be powerful in that sense, So just don't go to YouTube and do any mudra. Make sure that you have at least consulted somebody and then made sure that you can do it. Because something might be good for the heart, but it may not be good for something else. So you have to be watchful.
Correct. So are there any chances of these mudras going wrong? Like,
so it's not like an instant effect. It can cause issues, but not like instantly you did something and something will happen. Not like that. It's not that dangerous. But like any practice done wrong, over time, even if a movement is done wrong, you're going to cause problems later. So you're not going to immediately cause any damage, but it can cause imbalance of energies in the body, which can lead to issues.
So now let's talk about women's health in general. So fibromyalgia is a very big part of it, but I think there's a huge spectrum of women's health related issues where prenatal, postnatal care comes into the picture, where breast cancer and cervical cancer are some, who also suffer from a very long-term chronic pain. Menopause is a very big problem. What's the role of yoga therapy there? What you would say there?
So this is a broad spectrum of issues which we go through. What I have noticed in all the people who have come is, I don't know why, but most of the women, we take a lot of time to address the problem. Okay, something has been going on for some time, but either due to we ignore our health, or due to time and responsibility, because we may be working and we have the house to run. So first of all, I think women should take charge of our health, which I think now in our generation it is a little better than our mothers. Hormonal balances has a key role to play. Even for cancers, estrogen has a big role. So start from the beginning. At a very young age, people are having cysts and fibroids and PCOD in their early 20s. So hormonal health, I have a teenage daughter, she's 14. Right from now, I don't ask her whether she's studying or all that. I ask her, did you go to play today? Or did you do your breathing today? Because I realized by just the number of people coming to me that hormonal health has a very big role to play in women's life, right? It can, right from menopause, menstruation irregularities to dysmenorrhea to PCOD, conception issues, even in pregnancy, because there's back pain. Every stage of our life, it will be linked to your hormones. So take charge of your hormonal health, which is dependent on sleep, on diet, on your health. So actually you can't target one thing. You have to take care of your health right from the beginning, because our bodies go through changes. Our hormones are going through changes. We have peaks and we have 5 days of period, 5 days of PMS, pre and post. We have 10, 12 normal days. So we have to learn to identify in our bodies. If you are tired, rest. If you are active, exercise. But from very young age, start looking after your hormonal health, which is going to play a big part in how your bones will be stronger. Right? Hormones have a role to play in your bones as well. So each and every part, if you see, yoga can be a woman's best friend, because from childhood to the end of life, yoga balances your hormones. So it has a key role to play. Just simple things like breathing. Some practices that you can do every day to take care of your hormonal health. So if there's one thing that I would tell, I'll say do yoga from, if you have a girl child especially, just promote. My children are now Ghar ki murgi dal barabar, but promote yoga for girls especially, because their hormonal health is so important. Key point, right from the beginning to the end.
Right, makes sense. So before parting away, I have 2 questions to you. Anyone watching, any women suffering from chronic pain watching, what are the 3 or 4 signs that she should look at which will suggest her that she needs help? Maybe it's physiotherapy, maybe it's yoga therapy. And what are the 3, 4 best practices that she should start doing immediately to get out of that pain?
See, first of all, I would say reaching that diagnosis. If the diagnosis is there, at least you know what's going on. But like I said, be aware. If you really know that this pain is real, till you find out what's the cause, don't let anyone bog you down. Sometimes even your very close people are not understanding, right? So keep at it. Try to find out what's the cause of the problem. But at the same time, make sure that you are getting a sleep, because the 3, 4 very important things is sleep, right? You have to get good sleep. Is your diet. Don't have things that will aggravate and stimulate your body even more. Very basic things: coffee, tea, alcohol, very high processed food. So the key things is nutrition, right? The nutrition has a big part to play. Right? Be aware of what you put in your body. Sleep is very important. Movement is very important. And taking that time out for yourself. Every day there should be some downtime. Right? Don't be a superwoman. We want to be a superwoman and do everything and load our nervous system even more and fall into the trap, and you're not able to come out of it. Right? So don't try to be a superwoman. It's okay to slow down. There's no shame in taking rest and sleeping sometimes when you're tired. So as a woman, I can tell you that we take on too much. We are too harsh on ourselves. We are not kind to ourselves. We want to be kind to everybody but ourselves. So if you are going through something, it is okay. It is okay to slow down. It is okay if you're not doing your duties, which you think duties. You're not able to do it 100%. It's fine. Okay? Everyone has to go through it at some point. So be kind to yourself, but do what you can do. Sleep well, eat well, keep your mental health. Try to be in control of your mental health. I think that will go a long way and help you fight this battle. I would say it's a battle, and be on the other side of be on the side of the winning team.
Right, absolutely. So I'm a big fan of Luke Pitino as well as Ranveer Rawat, who's so in one of their podcasts they were telling, see, there's a lot of awareness about mental health and like mental health is a problem now. They were telling that's there, it's going to be there. What do you do for that? Your mental fitness matters more, right? And that should be the next narration, right? Everybody is aware of the thing that everybody is there, right? But abhi uske liye karna kya hai? And the most important thing is, I guess, self-care. The more self-care you take, the more self-care you practice, and you take it seriously.
Take it seriously. That is people. I tell my husband also, and even you and all people. Abhi I am out of that rat race now. Right. But see, when we miss our work day, 8, 10, 12 hours we are working. If we miss a meeting, or if we are by chance kuch ho gaya and you're not able to do, how much guilt? I didn't work today, is. But if he misses a yoga class or misses gym, or we never feel so bad. Because that is how we have become. Ki achieve karna hai. If you're not doing, success is associated with working very hard. Rest le liya to this person is not serious about things. See how things have changed. If you're not exceeding expectations, that is one of the things how it works. Meet expectations is not enough. exceeding expectations होना है, right? And your met expectation amazing, you know. We are not happy.
Correct.
We have not exceeded expectations. Like ऐसे है. So it's always running.
Yes.
That's why our nervous systems are, you know, and that's why so many diseases are there. It's amazing that how we have just shifted. There is no rest. You're always on your phone. Call is coming anytime. So where is the time for mental health? There's not rocket science. Just cut off after 6, 7. Call ही नहीं लेना. Also, it's easy for you to say. But I said that is what it is. Na? Otherwise, 11 बजे भी तुम कर रहे हो तो कैसे सोना? How will you get sleep? You're not able to shut down. You're not shutting down, then diseases will occur. So it's become very crazy now, the corporate world.
So I have a question for you. Sorry, because we were almost to shut, but I would like to ask this question. So your husband is in a very responsible position, I would say, right? And definitely they're running a fintech company and doing so much responsible job puts a lot of mental health related issue, and you are like a pillar to him to take care of his mental health and all, right? What are the 3-4 things that you constantly remind him that, you know what, no matter how bad is the day, these are the things that you are supposed to do?
One thing I just a joke I tell him, you know, if you lose your health because of only working all the time, and I'll be still young and healthy, then I'll give you 2 hours of my time when you're sick, and I'll keep a nurse who will take care of you, and then I'll go about my day. Okay? So, and I said you can do the same for me, because if you're not taking care of your health, there's no point of having so much money, right? There's no point at all. You're not able to enjoy your money, and you've lost your health. I said, so that is an important thing, okay? I am still fit and strong, and if you're not taking care of yourself and you fall sick, then my life will not, 2-3 hours in a day I'll give you, and then after that you're on your own. So that is one big, you know, motivator. Anyway, my husband is very calm in general. I'm the one who has high energies and I have to slow down. He's very good about compartmentalizing. He doesn't, you know, too much ups and downs, and his mind is not there. As a person, he's like that. But that being said, there is a lot of stress in the job, right? So I worry about his health, because heart attack, suddenly you hear something has happened. And in fintech, there are suddenly one bug and something has happened and lost so much money. So it's a very big stress thing. So he comes twice a week for my yoga classes. I take on Tuesdays and Thursdays. So he comes whenever he's in town. He will not miss my class. And he says that he's having a lot of. He used to have concentration problems, because once you have reached a certain level, your mind is everywhere. Right? He's unable to read a book for a long time, or if there's a, you know, he was finding that there is problem concentrating, and he says that yoga has helped him with concentration, plus spinal problem everyone has because of sitting all day. So he has taken charge of his health in terms of coming to yoga class. But as his nature is a little calm nature, I think he's able to manage his stress levels. And then I teach breathing and all that. I ask him, you know, have you? Sometimes I feel he has high BP. He says that my head hurts sometimes because there is so much of thoughts going on in my head. So then there are some 1 or 2 breathing that I've taught him. Start when the headache starts. It might be high BP, right? Start to do left nostril breathing. So things like that. Some 1 or 2 things that I have told him. Apart from that, I make sure that his diet, like, because nutrition is a very big part. So and because they are sitting on their desks all day, so diet has a huge part to play. So I make sure that the diet for him and the children and myself, of course, you know, diet and nutrition and sleep timings. We are not, as a couple, we don't stay up very late. I sleep very early. By 9:30, 10 I'm out. He also sleeps by 10:30, 10:45, which is also a very good thing, because you need to be able to switch off. So these are the 3 pillars, I think, for everybody: sleep, diet, and movement. You know, you have to do all of this, and everyday mindfulness, some mindfulness practice. That I'm unfortunately not able to get him to do. But I made him, he has a hobby other than his work, which I think for him that is a meditation. He does woodworking. So that's a good thing. So, you know, at least he knows the importance of, you're just alone and working with a piece of wood, right? So it is kind of a meditation for him. So mindfulness practice every day, something should be done. So these are the tips I would give everyone, actually.
Right. Yeah, that's amazing. And thank you so much, Priya, for doing this. It was really fun, and I learned a lot from you. What's next? So we are coming up with video-based exercise programs. People who are suffering from fibromyalgia. We are also working on cancer rehabilitation, self-care programs. So Please look out at HealthQ Rehab. We have collaborated with each other to make sure that we make this entire rehab, at the same time some lifestyle movement related practices accessible to people. So please download our app HealthQ Rehab, as well as you can also visit our website www.healthqrehab.com. Book and consultation with her. She's amazing, and her yoga experience and yoga therapeutic experience is going to definitely help you out. Follow her on Instagram. Her Instagram handle is Anamaya Yoga. We would be linking all of these in our description box, and looking forward to see you in another podcast. Thank you. Thank you, Priya.
Thank you, Meghna, for having me, and thank you all. Do come to HealthQ Rehab to check out.
Thank you.